Okay, hello again. So we were talking about corneal degenerations, right? So in corneal degenerations, what we need to remember is there are various corneal degeneration, a lot of corneal degenerations. So first and foremost, there is something which is known as an arcus senilis. Okay, just make diagrams along with me. Okay, so in arcus senilis, if you see this, suppose this is your eye. Okay, what happens is superiorly there is a semicircle like this, and inferiorly there is a semicircle like this. Later they turn into a circle. Okay, this circle is actually the color is white, even though I'm making it yellow over here. The color is white, so if you can make it white, it's better. um, just remember that the color is white. Okay, the color is white, but the deposition is actually a lipid. So there is lipid deposition, but the color is actually white. This is known as arcus senilis. If this happens in juvenile age group, then this is known as arcus juvenalis. Okay, arcus juvenalis. And remember, you need to remember a very very important thing, that there is cornea and there is this arcus senilis. The space in between this arcus senilis and this circle this space is termed as lucid interval of Vogt. Lucid interval of Vogt. Remember, from your forensic, lucid interval was seen in extradural hemorrhage. Okay, so from that also you can remember if you forget lucid interval of Vogt. Okay, and what you need to remember is usually this all the times if it is arcus senilis, it is always bilateral. If you see a single arcus senilis, unilateral arcus senilis, then this becomes this actually indicates contralateral carotid artery stenosis. Contralateral, suppose if it's having in the left eye, then over the right side. Contralateral carotid artery stenosis. Contralateral carotid artery stenosis. Now next topic, very very important, it is known as band shaped keratopathy. Now band shaped keratopathy, what you need to remember is, suppose this is the eye. Due to certain calcium metabolism errors, there is a band of deposit, and this band of deposit that occurs in your cornea, this is termed as band shaped keratopathy. This is termed as band shaped keratopathy. Okay, this is termed as band shaped keratopathy, and this band shaped keratopathy is actually calcium deposits, and this is usually age related. Okay, now most important thing, that this is because of hypercalcemia, all the things, vitamin D disorders, toxicity, hyperthyroidism, and parathyroid disorders. You can just write this, okay, because these are the secondary conditions for band shaped keratopathy. Number three is spheroidal degenerations. Spheroidal degenerations are also known as actinic degenerations, because the deposition are basically nothing, they are actually actin. Okay, these actin are actually protein deposits. I will take a pink color, and here there are some protein deposits, and these protein are nothing but they are actin. These actin deposits in the cornea, this is also known as Labrador keratopathy. Okay, and this, why did I make it a bit slightly pink? And it's actin. Okay, A for actin, A for amber. Amber color proteinaceous deposit, which is mainly actin, and this is due to UV exposure, sunlight exposures. Okay, next very important is known as Salzman nodular degenerations. Salmon's nodular degenerations. Salmon's nodular degeneration is nothing but actually it is, suppose this is your epithelium. This is your Descemet's membrane, Bowman's membrane, not the Descemet membrane is down. Okay, so from this Bowman's membrane arises hyaline components. Okay, so hyaline deposits above the basement membrane. This is known as Salzman nodular degeneration. Okay, and the next is 3, 4, 5. 5 you have vortex keratopathy. Vortex keratopathy is actually whirl-like. Whirl is something which is known as like this, like this, like this, like a whirl. Okay, like this. This whirl-like deposition is because of drugs like chloroquine, amiodarone, tamoxifen, indomethacin. Okay, and whirl-like pattern, it radiates from a single point to a distance like this. So this is known as a vortex keratopathy. I will show you all the pictures, don't worry. 6 is lipid keratopathy. In lipid keratopathy, it's because of abnormal metabolism of lipids. This might be primary, this might be secondary. If it is a secondary, it is secondary to infections of herpes zoster ophthalmicus or herpes simplex virus. If it is a primary, there is no neovascularization. The cause is unknown. Okay, but here there is neovascularization. And this is irregular deposition of fat, cholesterol, phospholipids. Okay, so I will just show you the pictures from this. So you can see here. Okay, so arcus senilis. So this is arcus senilis. You can see such a beautiful picture. Superiorly also there is a semicircle, inferiorly also there is a semicircle. This semicircle meet to make this one. Arcus juvenilis, it's written over here. Arcus juvenilis is seen in actually young age. Arcus juvenilis seen in young age, and there is lipid deposition in the stroma and Bowman's membrane. Okay, superior and inferior areas completes a circle, and there is the space. The space is known as lucid interval of Vogt, the space in between the arcus senilis and the cornea. Okay, and unilateral arcus senilis is usually seen in contralateral carotid artery stenosis. Band-shaped keratopathy is basically nothing. It's like this over here. Yellow pencil I will use. So this is actually calcium deposits, hypercalcemia, vitamin D disorders, hyperthyroidism, hyperparathyroidism, very important. Okay, spheroidal degeneration, you can see this, not that much clear, but actinic components you can see here like this, shining components. So these are actually proteins, mainly actin. Okay, it's also known as labrador degenerations. It's usually due to it's much more clear here. It's usually due to UV exposure, so avoid sunlight in treatment. Salzman nodular degenerations, you can see these hyaline components like this. These hyaline components arises from the epithelium. Okay, arises from the subepithelial Bowman's membrane. Okay, this can be easily peeled off. And this is due to chronic irritations like trachoma, chronic blepharitis, dry eyes, and the treatment is lubrication. Okay, it's because of trachoma, blepharitis, dry eyes. Next, what you can see is this world shape pattern. See, world pattern you can see here. This world pattern is seen because epithelium, all the deposits of the epithelium, when it renews, it just migrates in this manner. That is why we see this vortex keratopathy. And different drugs, as I already had written, chloroquine, amiodarone, tamoxifen, indomethacin, and Fabry's disease. When you talk about lipid keratopathy, this is nothing because This is nothing but it is actually deposition of the fat and cholesterol and phospholipids, and the cause is idiopathic in the primary. If it is a secondary, it is herpes zoster ophthalmicus and herpes simplex, and there is neovascularization. But here there is no vascularization. Sorry, not neovascularization. Okay, vascularization, just vascularization. So this was on corneal degenerations. Now, when we talk about corneal dystrophies, we'll be talking about epithelial, subepithelial, stromal, epistromal, and endothelial. Okay, we'll talk that in next